Hi, good afternoon, welcome. We're going to talk about breast cancer today. My name is Sally Sackett and I'm the clinical navigator at the Breast Center at Rochester Regional Health. I've been in that position about 10 months. I've been in the surgical suite for about 25 years. I'd like to introduce Jeff, Dr. Haynes.
How are you? My name's Jeff Haynes. I'm a physician in radiation oncology with the Lipson Cancer Institute of Rochester Regional Health. I've been with Rochester Regional Health for 8 years now since I finished my training. So, Sally, could you share today some of the information that you think is important for people to know about breast cancer?
Yeah, there's a few statistics that I think are important for people to understand how much breast cancer affects women and men in the United States. About 750,000 women are living with a diagnosis of breast cancer. That means 1 in 8 will have a diagnosis in their lifetime. 15% of new cancer cases are breast cancer cases. We talked a little bit about women, but men also get breast cancer. Their statistics are much smaller, but as important. They are compose about 1% of all breast cancers, meaning their risk is 1 in 1,000. The median age for a woman is 62. Risk factors, 2 that we can't even change. You're a woman and you're getting older. So as I look at those statistics, can you tell us how breast cancer is formed and how it evolves?
Sure. Yeah, that's a question I get a lot in my clinic, actually. Our bodies are made up of cells, and a cancer is also made up of cells. And so really, a cancer forms when the normal cells of your body transform into a cancer cell. And what that means really is that they've transformed so that they don't play by the rules. The normal cells in your body, they only multiply when more cells are needed, and they essentially stay in the organ where they belong. And so the problem develops when a normal cell in your body develops multiple mutations, first that allow it to multiply when additional cells aren't needed, and then to allow it to travel other places in the body and start tumors in completely different organs. And when both of those things have happened, that one cell that's gone bad will eventually multiply into so many cells that it becomes the medical problem that we call cancer. So I think that one of the things that's on a lot of women's minds is what can they do to make sure that if they did get cancer, that it would be identified as early as possible so we have the best possible options.
So there's a lot of things that women can do themselves. You always hear about the breast self-exam. You should do it monthly. Well, what that really is helping women do is identify their normal breast tissue, what it feels like, what the modules and everything feels like. So if they do feel something when they're taking a shower, getting dressed, they will realize that's abnormal. So that's very important. Women also go to their gynecologist and will have a breast exam from that physician. They also should start some screening. In the age about 40 to 44, women have the option of starting mammograms. And it's really important that women remember a mammogram is a screening. It's not a prevention. The other thing is, when we get to about the age of 45, they should be doing that annually for the rest of their life. I would say other things that risk factors that you could talk about that puts them in a situation that may cause them to have breast cancer.
Yeah, so the good news is that the risk factors, or I should say the things that you want to do in your life that make you less likely to get breast cancer are all the things that a lot of us are already trying to do to make us less likely to get other cancers or dementia or heart disease. The number one is to not smoke. Women who smoke are 25% more likely to get breast cancer than those who don't. Another one is to limit your alcohol. You know, that first drink a day is mostly harmless, but every drink a day after that a person consumes on average increases the risk of getting breast cancer by 15%. Likewise, it's important to maintain a healthy weight. So women who are obese after menopause are substantially more likely to get breast cancer because when the ovaries quit making estrogen, most of the estrogen is being made in the fat. And so if you have more fat, then you're a little more likely to get breast cancer. Even separate from weight, physical activity protects people from getting breast cancer. So women who are very physically active are 12% less likely to get breast cancer than women who are very inactive. And as it turns out, breastfeeding actually helps to keep a woman healthy as well as to keep the baby healthy. So a lot of people know that if you breastfeed your infant or you pump breast milk and give it in a bottle to your infant, that infant is less likely to get sick because you're able to share your immunity with it. What a lot of people don't know is that 1 year spent breastfeeding reduces a woman's risk of getting breast cancer by about 5%. And 2 years would be 10% and so forth. So unfortunately, even if we do everything right, if we get our screening and we do everything that we can to live a healthy life, we can still get cancer, including breast cancer. What do you think are the first things that a woman should do after she's been diagnosed with breast cancer?
You're going to get a diagnosis either through a screening, a mammogram, other screening tests. The first thing the woman should do is that person will give them a referral, either to a breast surgeon at breast centers such as Rochester Regional. They need to get the facts. They may also have a biopsy done from an abnormal mammogram. So when you go to the surgeon's office, there's a few things that are very important to understand. Start writing down your questions before that appointment. There's a lot of information that's going to be covered. The physician will go through pathology. They will go through the facts. What is true to your breast cancer? Because all breast cancers, as we know, react very differently. There's different treatment plans. Always bring someone with you to that appointment. Mm-hmm. You will hear the first 5 minutes and then not hear the rest of the hour discussion. It's very important to do that. They will ask a lot of questions about your family history. Important information to bring with you. Family members, any significant, close, strong family members have strong histories. Have you had any breast biopsies in the past? What's your own personal breast history? Is this the first time something has shown to be abnormal? Right. Those are all important things to bring. So going to that surgeon, they will then start talking about treatment options, which you can talk about because they are varied among your diagnosis of breast cancer.
Yeah. So, as you know, most breast cancer treatment, or really all breast cancer treatment, starts with a surgery. And when we can, we'll just do surgery to remove the tumor, what we call a lumpectomy. But sometimes the tumor is very large or invades into the skin, or there are other reasons why a woman still has to have a mastectomy, have the whole breast removed. After surgery, usually we go on to radiation therapy because surgery is very effective in removing the meat of the tumor, but there are often little tendrils of cancer that extend out into other parts of the breast or extend into the lymph nodes under the arm or above the collarbone. And radiation therapy is very effective at eliminating those areas of cancer. And then most women will go on to some kind of drug therapy. And that can be a pill a day, something like anastrozole or tamoxifen, that helps to reduce the effect of estrogen in the body on any cancer cells that are left, or sometimes it can even be chemotherapy or both. And those things really help to kill off any cancer cells that have spread other places in the body beyond the areas that we can radiate. A lot of women find it very stressful to be diagnosed with breast cancer. It puts a lot of strain both on the patient and on their family. What advice do you have for the family of people who've been diagnosed?
Well, it's a very stressful period of time. The person who is diagnosed with breast cancer, there are community resources, but we have to remember that the family members or friends, their closest support group, are going to have changing roles. They're now going to be the caregiver. They're going to be the person to go to appointments. They're going to need to help organize. And that person, the caregiver, is going to need some support, and there are community resources for that. They need to think about their own health and their feelings, their emotions, spiritual support. All those factors come into play as soon as that diagnosis begins or treatment begins. It is a family issue, stressful, and we see that our community in Rochester is very, very fluent in many organizations, from financial support for patients with breast cancer to community support groups. The American Cancer Society is a national organization. The Breast Cancer Coalition of Rochester, Gilda's Club, Camp Good Days, the YMCA, all these are available to people in the community, and we are so enriched with their facilities.
Yeah, absolutely.
What would you put Rochester Regional? How would you describe our relationship and how we care for the patient with breast cancer? What types of things? Because we work in different offices, different specialties, but we do cross paths. What sets us apart from the others?
I think that there are a couple of things that make me very proud to be a member of the Rochester Regional team. One of them really is your team. I think we have extraordinarily good breast cancer surgeons, not just from a technical standpoint, which they are. They're very good at making sure that even after surgery, the breast still has a natural shape to it. But also in kind of a broader sense, in the sense that our breast cancer surgeons have really taken the time to become broadly knowledgeable about breast cancer care. And I think that makes a big difference. You know, most breast centers, or most breast surgeons and most breast centers do not know how to do their own ultrasound. They don't do their own ultrasound-guided biopsies. So that we're really able to take care of a woman from the day that she identifies a lump in the breast, whether by a screening mammogram or examining herself, which you don't see very often. But also in the sense that they really have a depth of knowledge about genetics, a depth of knowledge about chemotherapy and radiation therapy, so that they're not just kind of taking a patient and saying, all right, I cut out your tumor, you know, go find some other doctors. They're really able to kind of lay out the whole treatment process from the outset and guide women through that. I think that more broadly, the Lips and Cancer Institute is very nicely integrated with our Breast Cancer Center, and that's reflected by our designation as one of the first breast cancer centers of excellence in the country. Which is partly a reflection of the fact that we all meet every week. So you and I get together and we sit down with our breast surgeons and other radiation oncologists, with medical oncologists who give the chemotherapy and the anti-estrogen therapy, and also with the radiologists that read the mammograms and the MRIs, with the pathologists that look at the tumors under the microscope. And that really allows us to bring together the full depth of the expertise of all our specialists when it gets down to the sort of more challenging cases where maybe the answer isn't quite as cut and dry, and I think that makes a big difference for our patients, and it's all of those things are part of the reason why we get good outcomes, both in the sense that we cure a lot of cancer, but also in the sense that the treatment experience is a good one for our patients.
I would agree. I'm very proud to be a member of Rochester Regional Health, and I'm sure Jeff agrees with me that we are happy to provide this information. If any of you have questions, please reach out to rochesterregional.org. We'd be happy to answer any questions you may have at either of our offices and facilities. Thank you.